Hope you all had a great weekend. I want to talk a little bit about why patients come for revision surgery, and I'm going to talk mainly about tummy tucks. As you guys may or may not know, I get a lot of revision patients these days. I mean, I'm just getting several a week these days that are unhappy with body contouring work they had done. As opposed to breast augmentation, where you get very unfew patients unless they're needing a breast lift also. You start to get a lot of unhappy patients when skin removal is involved or liposuction. That's when you really start to see unhappy patients. And the real common reasons can kind of be grouped into several categories. Number one, scars. So if the scar's high and it's not in the bikini line where you can't wear a two-piece bikini, it's not hidden, that becomes a source of dissatisfaction. Or if the scar is real wavy or the sides curve down or form dog ears, women will seek revision. Along the same lines, the belly button, I see a lot of really bad belly buttons. I see low belly buttons, and they tend to be like certain surgeons I tend to see repeating patterns on, or oddly shaped belly buttons, or off-center belly buttons, or belly buttons that were made too small. And I have surgeons telling patients stuff like put marbles inside your belly button, just weird stuff like that. The next category would really be lack of liposuction. So, basically they have square shape or they don't have any shape, and again, that can contribute to dog ears and things like that, or they decide now they need liposuction to give them more of the result that they desired. Also, pubic lift, that's just part of the procedure. The pubic area should always be lifted as part of the procedure. There are specific steps that have to be taken, and I don't think a lot of the surgeons out there know how to do those steps. So a lot of times the pubic area doesn't get lifted on patients, and over time will get worse and just sort of folds on itself, and that creates a great source of dissatisfaction, especially if the scar is too high. Then you know the pubic area hasn't been treated as well. So in those situations, most of the time these can be fixed. Patients need to always remember, and again, I have to spend a lot of time counseling my patients that I can't get as good a result doing a revision surgery as I could the first time around. It's really important to come and get expert care the very first time so that you're not trying to redo things which will end up costing you significantly more, and then you just won't be able to get as good a result. Remember, again, the most common mistake I see is the patient who had a breast augmentation, and then they tell their friend that their surgeon's great, but that surgeon doesn't really do body contouring, and then they just don't get satisfactory outcomes from skin removal, body contouring, liposuction type surgery. So do your research, make sure you're finding the right surgeon who's an expert in body contouring, and particularly an expert in liposuction, which is even rarer to find, to make sure you have a great result in body contouring. Thanks.